Good morning. I'm Dr. Manu Gautam. I'm Senior Consultant Orthopedic and Joint Replacement in Dharamshila Narayana Super Specialty Hospital, Delhi. So today we'll talk about knee arthritis, and especially knee osteoarthritis, which is an age-related problem which affects people in their 4th and 5th decade of life. So as we age, our knee starts getting degenerated. So what does degeneration mean? So we have a thick cartilage layer at the end of the bones in the joint, which provides a frictionless and smooth surface जो कि हमें walk करने में capable करता है without any friction and pain. So as we age, this cartilage layer is lost because of the friction, reduced synovial fluid and many other problems. So few people are more prone for it and few people are very less prone for it. It is very specific. So this is the knee joint. So this is an end of the femur bone, that is your thigh bone. That is your leg bone, and these together make your knee joint. So this is supposed to be a frictionless area. So as age processes, what happens is this smooth layer is damaged and it becomes raw. When it touches the raw area of the other bone, it creates pain. So pain होने का कारण होता है loss of this cartilage and reduced in the joint space, जो कि आपको walk करने में help करती है. So this is how knee arthritis begins. There are stages of knee osteoarthritis. Knee osteoarthritis, when we grade, it is grade 1, grade 2, grade 3 and grade 4. And हर stage के हिसाब से treatment modalities change होती चली जाती हैं. Grade 1 and grade 2 are early osteoarthritic changes, and patient just comes to us with a complaint of knee pain, walking for long duration and sometimes climbing up and down the stairs, which is patellofemoral arthritis. In early stages of the disease, it is very easy for us to manage the patient conservatively with medicines, rehabilitation, that is strengthening of exercises, weight reduction and few other modalities by which we can prevent the degeneration of the joint at the speed at which it was happening. So we can slow down the process and sometimes help to recover it also. In stages 2, 3, early 3, there are many modalities which add on to this conservative management, which is medicines, physiotherapy, rehabilitation, strength training, weight reduction, intra-articular injections, which are of many types. Steroid injections are there if you have severe synovitis and pain. There are viscous supplementation, जिसे हम देसी भाषा में grease का injection कहते हैं, which provides lubrication to your joints. And then recently, since last couple of decades, we have started using PRP and now GFC, which we make from your own blood. So we use your blood to create these medicines which are rich in growth factors which help in regeneration of your cartilage. So these are modalities which we can use to prevent your knee from getting worse in grade 1, grade 2 and grade 3. What if the patient comes to us in grade 4, severe osteoarthritis with severely damaged knee, with difficulty in getting up, walking, climbing up the stairs and down? In those stages, and if there is deformity, यानी कि पैरों में टेढ़ापन आना शुरू हो गया है, in those diseases, what we do, the only option which is left to us is joint resurfacing. We replace your knee, which is called as total knee arthroplasty or total knee replacement. So if you are having any problems related to your knee, do not delay it. The earlier you go to your doctor, the better the treatment chances are, and we can save you from surgery. The delay will definitely cause you severe osteoarthritis, disability, increased pain, reduced quality of life, and eventually you will end up having a surgery.